Hi, I'm Dr. Meenakshi Banerjee, Senior Consultant in Obstetrics and Gynecology in Madhukar Rainbow Children's Hospital and BirthRight. As we all know, October is the month of breast cancer awareness, and I would like to take the opportunity to aware you about various symptoms, treatments of breast cancer. As we all know, breast cancer is globally the first and the most commonest cancer in women. And now in India also, it has moved its place from the 4th position to the 1st place, so that we can understand that how dramatically its incidence is on the rise. So who should be aware of this? Women, yes, the breast cancer is very common in women, even though it can happen in men also. Okay, but women are more affected by the breast cancer. So women should be more aware of what should take them to the hospital or would prompt them to go to the hospital. Okay, so what are the symptoms? Generally, the breast cancer comes with a simple symptom of appearance of a new lump in the breast. More the denser the breast are, more difficult these lumps are to be, they can be palpated by themselves. So the women who have any new lumps appearing over a period of time and they have experienced anything new coming up, they should go to the doctor and show themselves and get themselves clinically checked. As such, we always tell a women to examine themselves every month, post cycles, to examine for any new changes, or appearance of a newer lump, probably post cycles, because the congestion, the water retention during the post cycle is lesser, and then they can palpate themselves well. Many a times when you will start examining yourself, in the initial phases you will not understand what you are doing, but 2-3 times when you do it, you understand what your normal breast feel is, because every woman can have a different breast feel. Some may have a denser breast, some may have a normal breast with the less breast tissue, more fatty tissue there. So probably by examining yourself, you will be the first person who will come to know when to reach to the doctor at the earliest. Breast cancer is a very preventable cancer nowadays, so early we pick up, early is the chances of its cure. The other symptoms which you should look forward for is any changes in the skin color, flaky skin, any new inverted nipples. People may have inverted nipples from beforehand also, but any new changes or inversion happening, any nipple discharge which can be bloody or blood stain or a different variety, newer nipple discharge, should prompt yourself to go to the hospital and get yourself checked by your doctor per se at the earliest. Who are more prone for it? We should understand. Women definitely who are more older in age group, more than 40 years of age, are more prone for it, who have a family history, who themselves have breast lumps, who have been there beforehand and any new changes are happening, they are more prone for getting breast cancer. Family history or a nearby first degree relative makes you more prone as compared to your peers to get that cancers. Third thing, early women who have started their menarche, or that is the early starting of the cycles, and they have a later menopause, then they have a lot of estrogen support or hormonal stimulus happening, so they are generally more prone for having it. Lifestyle changes like smoking, alcohol makes you even more prone for getting a breast cancer. Women who are obese and who have a higher BMI should make their work lifestyle so much that they do not gain weight. So all this risk factor elimination can be done if we know what are the risk factors. So obesity, alcohol, smoking, older age group, high family history, genetic history, personal history of anybody who's having a lump which was previously there, and any new changes happening, any changes in the skin, should prompt you go to the doctor early and get yourself checked. Because breast cancer, as we all know, if we pick it up early, definitely the chances of cure are much more and very faster, and they can be cured to the maximum course. Prevention is always better than cure. Let us make women more healthier and more stronger for the future. If the women are healthy, I think the pillars of the society and the family is healthy.